Um, Thank you so much. Again, thank you for joining us. So this is our team for community relations. We have Alita Thoreau, who's our community relations manager, Sue Castillo, who's a community relations coordinator, Afia Jones, who's new to the team, who's been an excellent addition. She's also a community relations coordinator, and myself, Aisha Massey. So please follow us on social media. We are on Facebook, Instagram, and we now have a YouTube page. So follow us to keep up with upcoming events and a wealth of health resources. We will have upcoming events in 2025. They will be announced soon. So just be on the lookout for those. And about us, we are Urban Health Initiative, which is UChicago Medicine's community health division, responsible for collaborating with community-based organizations on health-related programs, research, and services for residents on the South Side of Chicago. And some of our programming includes health and wellness programs, high school healthcare career events, sponsorship events, community health focus hour, which is on WVON radio, AM 1690, community newsletter that goes out biweekly, fitness classes, free, and volunteer engagement opportunities. So we're going to meet our speakers. Up first, we have Anthony Douglas II, MD, who is our general surgery resident here at UChicago Medicine. Dr. Douglas is a general surgery resident physician at UChicago Medicine. He has focused his training on caring for trauma patients and addressing the root causes of violence through advocacy, policy, and community activism. And Dr. Douglas is from South Bend, Indiana. Welcome to the show. Next, we have Belinda Schultz, who's the Director of Office of Managed Care at UChicago Medicine. Ms. Schultz is the Director of the Office of Managed Care. She has lived in Chicago for almost 20 years. Some of Ms. Schultz's hobbies include spending time with family, friends, and walking her new puppy. Love the new puppies. And finally, we have Nicolette Nikki King, who is our senior patient advocate who joined the team in February of 2022. She is deeply passionate about addressing health inequities and is committed to ensuring that all patients, especially those in underserved communities, have access to the care and support they need. Hey, Nikki. So I'm going to stop my share and we are going to jump right on in with Dr. Douglas to get us started.
Can you see my slides?
Yes, but they are kind of
Small?
like they're, and
How about
there we
now?
go. There we go. Yep.
Okay, perfect. Well, thank you. Thank you to the Urban Health Initiative for this opportunity to talk to you all about an important topic. Also, thank you all for spending your evening here with us to talk about this. I think I have about 10 to 15 minutes, so we'll jump right into it. We're going to talk about deciding between emergency room care, urgent care, or primary care, and how to make that decision, what factors to consider, and ultimately making sure that you get the care that you need in the situations that you're in. So I want to start by breaking this down and making it as simple as possible. The decision to go to either the emergency room, to the urgent care facility, or primary care facility should be based on two things: symptoms and pre-existing conditions. Symptoms, what I mean by that is the severity of the symptoms, how serious your symptoms are, and we'll go through a list of symptoms that are considered very serious versus symptoms that are less emergent. And then we'll talk about pre-existing conditions, which are other conditions that you're living with, like chronic diseases, whether that's diabetes, high blood pressure, et cetera. What are serious pre-existing conditions, and what are pre-existing conditions that don't necessarily necessitate an emergency, but do require you to see your primary care physician. Let's see. So we'll start with symptoms. What are very serious symptoms that often necessitate you going to the emergency room? Well, we'll start with chest pain is a common one. And what I mean by chest pain is not the type of chest pain that you can touch and reproduce, or touch and it causes pain. I'm referring to the pain that is underneath your chest. So that is, again, that's pain that you can't necessarily caused by touching, but just exists in right beneath your sternum. Your sternum is essentially your breastbone or the big bone in the center of your chest. Now, for women, chest pain that is serious can not only present as chest pain, but also can present as nausea or pain, upset stomach, and that is important as well. Oftentimes, signs and symptoms of a heart attack in women present in this way versus in men, they present as that classic chest pain. Feels like an elephant is sitting on my chest. That sort of pain. So these are important distinction. Women certainly can have the chest pain below the breastbone, but often a lot of times it presents in this way for women as upset stomach or nausea. Bleeding is always can be, of course, an emergent symptom. And what does emergent bleeding look like? Well, it looks like bleeding that doesn't stop after holding pressure for 5 to 10 minutes. It looks like bleeding that pools on the floor and creates a puddle. Any bleeding that is pulsatile, meaning it's squirting or has a velocity to it, energy to it. Bleeding that soaks through clothing, and I want to be very specific, not blood that stains your clothes, but blood that in fact creates a large soak. It soaks your clothing, essentially makes your clothing wet and changes the entire color of your clothing. Okay. Other symptoms that are very important that could be very serious that necessitate emergency workup is any weakness that is on one side of your body. So if your arm and your leg on one side of your body is weak, or you have slurred speech, or facial paralysis, which means one side of your face is droopy, or one side of your face is moving, but the other side isn't, which oftentimes people will tell you that before you recognize it, or sudden blindness. These are all very important symptoms and early symptoms of a stroke that require emergency workup. Confusion and delirium is always an emergency. So if somebody is confused, they don't know where they are, they don't know the year or where what their name is, or someone that they usually easily recognize that they are no longer able to recognize, like a mother, a sister, a brother. And any type of delirium is considered an emergency. Any type of extreme fatigue, and I'm not talking about the fatigue after a long day of work, but the type of fatigue where somebody cannot stay awake. You're touching them, you're pushing them, you're asking them to stay up with you. That type of extreme severe fatigue is also considered an emergency. Shortness of breath is also an emergency, especially for those with certain pre-existing conditions, and we'll get into the specifics of that. But not the shortness of breath after doing the stairs, which we all sometimes, I know for me at work, sometimes after doing a couple flights, we all feel short of breath. But we're talking about the shortness of breath where you feel like you can't catch your breath, that you're struggling to get air in, and you're breathing rapidly. That type of shortness of breath is very concerning. A loss of consciousness is always concerning and requires you to come to an emergency department. Any type of severe abdominal pain, and what I mean by severe abdominal pain is, you're sitting in a chair and somebody bumps the chair and that causes you significant severe pain. The type of pain where you can't stand somebody to even place a single finger on your stomach. Those type of severe abdominal pains require emergency workup, as well as intractable vomiting, meaning you've been vomiting 6, 7, 8 times, unremitting, it's not stopping. That type of vomiting requires emergency workup. Severe headaches. I know oftentimes a lot of us who sit in front of computers and do strenuous work have headaches often, but these are the type of headaches that are the worst headaches you've ever had in your life. You're completely debilitated. You can't function at all. It feels like essentially your head is going to explode. That type of headache is considered an emergency. Fevers in children less than 1 is always an emergency. And then any type of injury that involves a high-speed vehicle accident, a gunshot wound, a stab wound, or a fall from a significant height is all considered emergency. So these symptoms that I listed here are all reasons you should go to your emergency department. Now we're going to talk about pre-existing conditions. Remember, when we're evaluating whether you should go to the emergency room, it's based on the severity of your symptoms, the symptoms I just mentioned, and then these conditions that make your symptoms more prone to being a very serious situation. So age is always important, right? Chest pain in a 16-year-old is a different than chest pain in a 60-year-old male, right? And so keep that in mind. Those who are more seasoned and of older age, certain symptoms are much more serious than others. Long history, meaning 15 to 20 years, or uncontrolled diabetes is a serious pre-existing condition. So when we talk about chest pain, when we talk about some of the other symptoms that we mentioned earlier, shortness of breath, different types of severe abdominal pain, that is more serious in people who've had these type of conditions for a very long time or haven't been treating their conditions appropriately. That goes for high blood pressure. That goes for heart disease or coronary disease, which is often referred to when you have blockages in the vessels that supply your heart. Kidney disease, and not just any kidney disease, but those that are on dialysis or those who are close to end-stage renal disease, meaning stage 3 or stage 4 kidney disease. Lung disease is important. Anybody who has a chronic obstructive pulmonary disease, which most people know it as COPD. If you have somebody that smokes in your family, you may be familiar with this condition. Asthma, of course, can be a very serious condition for those who have severe asthma. Those who have a long history of cigarette smoking, things like shortness of breath, coughs, fevers, those kind of things are a little more serious in people who have been smoking for a very long time versus someone who's been maybe smoking for a year or two or hasn't smoked ever. Anyone who has a history of stroke or heart attack, your symptoms are very serious and should be taken seriously. And that would push you more towards going to the emergency room versus the urgent care facility. If you have a history of arrhythmias, meaning the most common arrhythmia is atrial fibrillation. AFib is how most people know it. That is important and is a pre-existing condition that should be taken seriously. People with heavy alcohol use, history of drug abuse, history of suicide attempt, and then anybody who has had recent surgery within the last 2 to 3 weeks. Any of those conditions that people have are very serious and should be taken seriously when you develop some of the symptoms that I talked about earlier. And so here's just a list again. And to make it simple, I want you to think about when you're deciding where I should go, the emergency room or urgent care. If you have any of these very serious symptoms and or you have these very serious pre-existing conditions, this should push you more towards going to an emergency room versus the urgent care. So keep this in mind. These pre-existing conditions make the symptoms on the left a little bit more serious than if you were someone who is younger and healthy. When we talk about urgent care, I like to make it simple. Urgent care is for any type of care you need after hours or on the weekend that can't wait until your clinic is open on Monday, right? Or until the clinic opens in the morning. And so the most appropriate patients for urgent care are those who are young and healthy with no serious pre-existing conditions, okay? Those with minor injuries, such as small cuts, bug bites, those who have mild to moderate musculoskeletal pain, your back is sore, you sprained an ankle, you think you might have fractured your wrist, those type of things. Small burns, which when I talk about small burns, that's you accidentally touch the hot stove with your finger or those sort of things, not burns that burn your entire forearm or encompass your whole hand or a very sensitive area of your body part, like your genitals or your face. Those type of burns require more serious attention. Coughs, sore throats, and fevers in people who are otherwise healthy typically are appropriate for urgent care. Now, again, if you have pre-existing conditions like, you've been a smoker for 20 to 30 years, or you have a family member that's been smoking that long, and they develop a severe cough and a fever, pneumonia, and those type of things are a little bit more serious for those people than they are for someone who's healthy. And again, I want to emphasize that fevers in children less than 1 are serious. So those require you to go to the emergency room. Headaches, just normal headaches, are okay for urgent care, meaning not those severe headaches that we talked about, the worst headache you've ever had in your life, feeling like your head is going to explode. Earaches, upset stomach or nausea or vomiting, that is not severe, meaning it's not unremitting, should go to the urgent care. Any type of difficulty or pain with urination in someone who has a history of like a urinary tract infection or has a history of a sexually transmitted infection, those things are appropriate for urgent care. If you have a concern for a fracture, a sprain, or a strain, those are appropriate for urgent care. And then lastly, any type of allergies. And I want to be specific, not anaphylaxis, which anaphylaxis is the most severe allergic reaction where someone has difficulty breathing, their throat is swelling, they're hyperventilating and breathing rapidly, they're losing consciousness, or their face is extremely flushed and they feel like they're going to pass out. That is more so anaphylaxis. But your typical allergies, shorten your cough or sneezing, runny nose, those type of things belong in urgent care. Everything else, to keep it simple, is primary care. So anything like questions about medication or managing your diabetes, those type of things belong to primary care, and those are things that can wait for you to call the office and see if you need to come in and have an appointment, or they can advise you over the phone. So I'm happy to take questions at the end of this and get more into maybe some of the specific questions that are out there, and thank you for your time.
Thank you so much, Dr. Douglas. If anybody has any questions, please feel free to put them in the chat right now. And like I said, there will be time for you to verbally ask your questions as we're done. But if you have something that you just want to ask right now, please put it in the chat. And thank you again, Dr. Douglas. So we are now going to move forward with Ms. Belinda Schultz.
Good evening, everyone. Thank you for attending tonight. Hopefully, I'll answer some of your questions, and feel free to put the questions in the chat. I'm also going to put it's our managed care email box, and that is comes directly to myself and my team, and we answer questions that come to us from patients, physicians, clinicians, or anyone who has an insurance question. So feel free to reach out that way as well. I'm going to share my screen. I just wanted to start tonight and do some quick updates on things that's happening in the insurance area for folks. There's some end of year is always a busy time, so I want to make sure that I'm just highlighting some of the most important, let's see here, most important things for folks just to be aware of, because some of this is time sensitive. And I'm sorry, this is a little bit different version than what I'm used to. But I will go from here. So just some quick updates. For any of our senior folks, I'm sure you're aware that Medicare open enrollment closed recently. It was from October 15th to December 7th, and that was kind of the one time of the year, unless you have a special change, that you can change your insurance plan. Unless you're in a Medicare Advantage plan, and then there's an open enrollment period from January 1st to March 31st, where you can change your plan or switch back to original Medicare. So just wanted to make you aware of those timeframes in case you're looking to change your plan. These are the University of Chicago Medical Center currently contracted in-network Medicare Advantage plans. There's a new plan that you may have seen around. We've been doing a lot of advertising. It's called Essence Healthcare. They're a new Medicare Advantage plan that we're in network with. We're also a network with Aetna, Blue Cross, Humana, traditional Medicare, which is the original Medicare that folks get, any Medigap or Medicare supplement plan, and then the Medicare, Medicaid plans. We're currently not contracted with any, and the state's actually changing that plan in 2025 and 2026. So, oh, I see 2 questions already. The slides are, oh, thank you for giving me that heads up. I see that they're not changing. I apologize. Let's see here. I'm going to try and change this. There. Is that better? Can you see now the list of plans? All right. Thank you.
Thank you so much.
Thank you for letting me know that. I appreciate it. And again, just to go, the next piece of timely kind of information I wanted to share is just about the marketplace or open enrollment, the exchange plans or Obamacare. This is also an open enrollment time period for that group, and it started November 1st. And for folks who picked the plan before December 15th, you will have coverage starting January 1. You still have some opportunities. If you haven't signed up by December 15th, you can sign up by January 15th, and then that will be the last day you can actually enroll or change your marketplace plan. Otherwise, you're locked into that plan for the next year or so. It requires that you pay your first premium, and then you'll be covered. And then these are the exchange plans that the University of Chicago is in network with. The Aetna CVS plan, Blue Precision, Blue Cross My Blue Plus, and Oscar Health. I also just put a link in here to the UChicago Medicine Insurance website, and that lists all of the insurances that we're in network with and out of network with. And again, I will put this information in the chat so you can go out to the website to look. I think end of year is just kind of a busy time, but it's always important to look at not only who your hospital's in network with, but who your doctors are in network with. As Dr. Douglas was kind of talking about going to the ER versus primary care versus urgent care, you can see there's also financial implications and insurance implications to those decisions. So it's always good to kind of look at that in advance. I mean, hopefully none of us are going to have to go to the ER, but it's good to just kind of know kind of what the implications are of those. I did actually want to spend most of my time, I don't have a ton of slides, really giving everyone on the call the opportunity to kind of ask questions. I'm happy to take all insurance questions that you might have. I know it's kind of, I've been doing provider relations work with insurance for over 20 years. I still get questions on a daily basis that are new to me. So there's always a lot of good questions out there. So again, happy to help for all the folks on the call if there's anything that you'd like to ask about. Otherwise, I can continue to walk through all the intricacies of insurance that I'm aware of. Any questions that I can answer for folks? You all are pretty quiet tonight. The other thing I will mention is, I know that we've recently, as of last year, acquired, we work closely with the 4 Advent hospitals that are out in the suburbs. And we also have a newly opened, like I said, opened at the end of April. The year's gone so fast, it still feels new. Northwest Indiana location. The Northwest Indiana location has all of the same insurance contracts that the Hyde Park location does. I will let you know that the Advent hospitals have most of the same insurance plans, but they do accept some additional ones. So if you go out there, you may want to double check before you go to your first visit, just to make sure that you're in network, but just something to be aware of. And if you think of any questions, again, I'll put the email address in the chat, and then you can send any questions that you may have if you want to just ask them directly to us instead of on the chat. Please feel free to do that.
And I'll also be sure to include it in the follow-up. So I'll include the email link that you shared as well as your email address if they have additional questions. So,
Perfect.
but
Thank you.
now if anyone does have any questions, please feel free to ask Belinda because she will not be here through the full entire workshop. So now will be your time. But if not, Belinda, if you have any additional slides that you wanted to continue on with, you can.
No, that was the deck I had. I really just wanted to kind of let folks know about some of the more recent changes that we have, and then also just kind of wanted to give folks a chance to ask questions. So that is my presentation.
Okay, thank you so much. We appreciate that. And everything that Belinda shared with us, like I said, it will be sent in the follow-up email so that you can, have access to what she did share. But thank you again, Belinda. We appreciate you. So we are going to move forward with our next presenter, Nikki King. And I have slides for you. So let me pull those up.
Perfect. All right. So hello, everyone. My name is Nicolette King. Please feel free to call me Nikki. I'm a senior patient advocate with the Urban Health Initiative, and it is a pleasure to be here with all of you today. So a little bit about me. I was born and raised on the south side of Chicago, and those experiences have deeply shaped my passion for addressing health inequities, especially in underserved communities like the one I grew up in. I'm excited to dive into today's discussion on the differences between when to go to the ER, emergency room, versus urgent care versus primary care, and to share my perspective on how these systems intersect with the patients I serve every day. Next slide, please. All right, so more into my specific role. The Medical Home and Specialty Care Connection program, also known as the Patient Advocates, launched back in 2005. It actually was one of the flagship initiatives for the Urban Health Initiative. The emergency department ED-based program is dedicated to improving access to care for patients on the south side of Chicago. And we currently are a team of 12 dedicated individuals. We specifically support patients recently discharged from UChicago Medicine's emergency room, and we assist with follow-up care, whether it be primary or specialty. We also provide assistance with healthcare navigation, which can always be challenging. We provide resources to address patient immediate needs. For example, if we come across a patient that requires transportation to a follow-up appointment, we not only connect them to the right resources, but we also assist in actually arranging that transportation for the appointment. Most importantly, collaboration. We collaborate with several community-based organizations and internal programs within UCM to support our patients holistically. So for example, our liaisons and care team help patients with different chronic conditions. We have the Violence Recovery Program, VRP, that supports those affected by community violence. And we also have the SSHCO, also known as the Southside Healthy Community Organization, and they help address social determinants of health. So things like food, housing, and transportation. Together, we ensure that our patients receive care not only for their medical needs, but for social and emotional support that they may require at times as well. Next slide, please. All right, so now that I've shared a bit about my role and what I do day to day, let's dive into today's discussion about when you should go to the ER versus urgent care versus primary care, but more specifically from a perspective of someone who works with the patients. So through my work in the emergency room, I've seen how these different care settings really play out in real life. And I wanted to share a few key takeaways from what I've observed while working with patients that I think are important to think about when deciding when to go to the ER versus urgent care versus primary care. So just to make sure we're all on the same page, Let's quickly revisit these 3 care settings: primary care, urgent care, and the emergency room. Primary care is the ongoing day-to-day health care you receive from your primary care provider, also known as your PCP. Whether that's a doctor or other medical professional, this is your first point of contact for most health concerns and will help coordinate any specialty care you need. You typically need an appointment to see your primary provider, and wait times vary based on the appointment schedule. Insurance plans cover primary care, and you should always review your plan benefit. Urgent care is a good option for when you can't get into your PCP's office soon enough. So you're experiencing something that is more urgent. An example of this would be a persistent cough or a sprained ankle. Urgent care centers have extended hours outside of the typical business hours of a primary care provider's office. There are no appointments needed. Walk-ins are welcome at urgent care centers. And some urgent care centers allow online check-ins to reduce wait times. Insurance plans also cover some costs associated with urgent care visits, but however, always check with your plan's benefits. Then we have the emergency room. This is for life-threatening conditions that require immediate attention, such as a stroke, heart attack, severe trauma. The ER will take care of your immediate concern. Of course, appointments are not required. However, the wait time can be longer for non-critical cases compared to those critical life-threatening cases. Typically, when discharged from the emergency room, the doctors will tell you what follow-up care is needed, which is usually following up with your primary care provider or a specialist. This care setting has the highest cost, but again, review your insurance plan to see what costs are associated with emergency room visits. One thing I've noticed is that many of our patients come into the ER for issues that really could have been handled by their primary care provider. And while I'm sure we've all been there waiting in the ED for what feels like forever, a lot of these concerns like medication refills or common cold symptoms really could have been addressed earlier in a more effective and efficient way if primary care was utilized first. Of course, you should always go to the emergency room if there is a threatening issue. I can't stress enough how important primary care is, especially as a preventative measure. Primary care is all about monitoring and managing your health regularly so you can catch things before they become urgent or emergency level problems. In the long run, it's the most effective way to manage your care. So now when reviewing the differences between the 3 care settings, I would really like to stress the importance of knowing your healthcare benefits, the plan benefits, and making sure that you're connected to a primary care provider. Next, let's jump into some helpful tips to use when you see your primary doctor. Next slide, please. Thank you. So this is one of the resources that we provide to the patients that we see when we schedule them follow-up care. We have an amazing provider, Dr. Christmas at UChicago Medicine, who shares some really helpful tips for patients to make the most out of their doctor's visits. This is important because at the end of the day, it's your health. We want you to be in control and fully aware of what's going on. That's exactly what your provider is there for, right? To help guide you and answer any and all questions you may have regarding your health. Here are some key tips to keep in mind for your next appointment with your provider, and you may already be practicing some of these, which is great. Just make sure to consider all of them to maximize the value of your visit and make well-informed decisions about your health. So number 1, I've got provide as much information as possible when scheduling the appointment. This is very important to make sure you get the most appropriate doctor for the right amount of time. This is very important. When you schedule your appointments, your follow-up, you do want to make sure you let the scheduler know what you're trying to be seen for, because you want them to get you connected to the right provider for that specific thing you're being seen for. You want to make sure you have the right time slot, you're in the right place. That makes things so much easier. So provide as much information as you can when you schedule your follow-ups. Number 2, which really should be number 1, understand your insurance coverage. This is really important to know your benefits, what you can and can't do with your insurance plan. This really helps when deciding to go to urgent care versus primary versus, the ED. The benefits are different. Costs are different for each. Number 3, be truthful about medical history and symptoms, which means you may not want to have a friend or family member present if there are things you don't want them to know. This is important. Just always be truthful about what's going on with you when you're speaking with your provider. The more they know, the more they can help you. So that's very important. Number 4, go in for yearly exams. Developing a relationship with a doctor before there is a problem is vital to optimal health. We typically, you see your provider once a year. If something's going on, you would see them a little bit more, but check in with your doctor and really develop that relationship, because it really makes a difference with your overall long-term health. And then lastly is listen first, repeat to make sure you understand, and then write it down. I think this is very important, because when you see the provider, you want to make sure you're listening to what they're telling you, right, during your visit, but you also want to repeat it to them just to ensure that you understood what they told you, there's a connection, and then write it down if you need to, because when you leave the doctor's office and you're at home and you have to manage, right, this health concern you came in for, it's important that you understood and were aware of kind of those directives from that provider. Last slide, please. All right, and that is it. Thank you, thank you. I really appreciate you all taking the time to join the conversation today. It's been great to share these insights with all of you, and I hope that you walk away with a better understanding of when to go to the ER versus urgent care versus primary care. And this really does play a role in your healthcare journey. So thank you again, and I look forward to the rest of the discussion.
Thank you so much, Nikki. Great presentation. So now I'm going to open up the floor for questions. Each of our panelists provided some very, very great information. So as you all have taken it all in, please feel free to unmute yourselves if you'd like to ask some questions. This is a great workshop with a wealth of information. So we want to, make the best use of our time. So really quickly, Nikki, if you can just again just reiterate the fact that as your role as a patient advocate, if you get someone who comes in who, you get patients who are leaving ER, being discharged from ER, right? Is that your main? Okay. So they don't have a primary care physician to see for follow-up. So is that on you to, help them get situated with a primary care physician?
That is what we assist with. And whether they're in network to come here to the university or not, we still find them a primary care appointment to get them connected with that medical home.
Okay, that was going to be my question. Does it have to be UChicago medicine affiliated?
It can all places.
That's wonderful. Good to hear.
All insurances.
Okay, wonderful. Okay, thank you for that.
No problem.
All right, anybody else? Okay, looking here. Questions, appreciate y'all sharing. Okay, thank you for that, Kenny. Yeah. So team, or did you all have anything in addition that you'd like to add to, before we, we're not going to shut down just yet, but I'm just trying to leave it open so that, anybody can add anything, ask questions. So we're open.
I was just going to add, Nikki said it very well, but the importance of having a primary care physician cannot be emphasized enough. Oftentimes, especially as a surgeon, we see people come in for conditions that could have been preventable, surgeries that were unnecessary if they had a primary care physician that was able to manage their chronic disease or pre-existing condition and make sure that they had access to the appropriate medication and could afford the medication that, was prescribed. And so, you cannot emphasize enough how important it is to have a primary care doctor to prevent you from ending up in the emergency room and prevent you from having more serious complications from diseases that can be effectively managed with a single doctor outside of the hospital. So Nikki did an amazing job, and I just want to highlight that point, the importance of having that primary care doctor.
Thank you, Dr. Douglas. And like she also specified how important it is to know your insurance. It's so important to know that. And I thank Belinda for her presentation where she outlined, the specifics of insurance. So it is important to know, because you may go in for, something that is not particularly covered or what have you. And just being able to know what you can do with your insurance. So thank you. Melanie, go ahead with your question.
Yes, hi, thank you. And thank you for this discussion. I'm curious, if a patient comes in, needing medication refill and there are costs, they may not be able to afford it or what have you. Like what can we do for those patients, right? Like I think oftentimes that's sometimes why people go to the ER for medication refills, like Nikki said. But like how can primary care, urgent care, and the emergency room like help these patients who may not be able to afford the medication that they need?
I think it's a tough question, Melanie. I think that obviously there's an issue not only in our state and our country with affordable prescription drugs, and something that is trying to be we're trying to fix in the state of Illinois right now. But in practice, I think the importance of having a primary care doctor is that oftentimes they can navigate those situations where your patient is on a medication that they are struggling to afford. Oftentimes, physicians have free samples to administer to patients for whatever situation or conditions that they're in. And if there's a situation where they don't have enough free samples or don't have access to discounted medications, they can work with that patient to figure out what is a better regimen for them given their financial situation. And so I think that your question highlights the importance again of having a primary care physician. Certainly we do see situations where people coming through the emergency department and for access to medications, but end up leaving with very hefty medical bills as a result of utilizing the emergency room to get prescription refills. And so it's very inefficient, not only for the healthcare system and for the hospital, but also for the patient themselves who generate a large bill that for services that they may not even use, right? A lot of the bills in that emergency room visit are not only just for you utilizing whatever services you utilize, but for normal operations of an emergency room are included in that. So it's inefficient not only for the patient, but also for the healthcare system. So it's important again, and emphasizes the why having a primary care doctor who knows your financial situation and knows your condition well and can prescribe the most adequate regimen for you.
Thank you so much for that, Dr. Douglas. Anything else? Anybody else want to chime in or? Okay. For that, any additional questions? All right. Yeah, if not, I don't want to stretch this, but again, I definitely do appreciate you all's time. And as mentioned, I will definitely send a follow-up with the link that was shared by Belinda, as well as information if you'd like to get in contact with our presenters about any additional questions that you may have. So yes.
I'm so sorry. I got a direct message. I think that this was meant to be sent to everyone, but it was, what steps can I take to understand and advocate for my medical needs during a doctor's appointment? So I think that's an amazing question, and we've got a doctor right here with us. From my perspective, at least in the patients I work with, of course, it's just really asking questions, making sure that when you see your provider, you ask questions and you understand what they are telling you. That's my main thing, kind of being open and advocating for yourself.
Yeah, I 100% agree, Nikki. I think that it's important, one, that you feel comfortable and you have a good relationship with your primary care doctor. You know, I had this conversation with my father a lot, who switched physicians recently, and I've encouraged him to, because he didn't feel comfortable with the relationship that he had with his physician, and he didn't feel comfortable asking questions and you know, going through in the regimen that he was currently on. So you know, I always encourage people that if you have a physician, currently a primary care doctor, that you just don't feel comfortable asking the questions that you need to, that you feel like your concerns are often dismissed, then you should consider switching physicians. But for those of you who are just are happy with your physician but just want to get the most out of those visits, coming to your physician with questions already prepared, a list of questions, is always welcomed and accepted, so that you can get the most out of that visit. Certainly, you know, asking, you know, if there's something that you don't understand, asking your physician about the questions that you have about what they're recommending and why they're recommending it. Okay, no physician should be offended by your questions of, you know, why is this the best for my situation? That's a reasonable and appropriate question for any physician, and they should have a response for that. You know, be honest about your situation, right? Nikki mentioned earlier, you know, the physician's office is not the place to lie, right? Your physician signs an oath of confidentiality for a reason, so that they can provide the best care for you. So be honest, don't lie to your doctors, tell them the truth. Tell them about your social situation if it's relevant to your care, right? We just talked about prescription affordability. If there's a drug that you can't afford and you are taking sips of that medication or splitting those pills because you can't afford the refills, that is information that your physician should know, so that they can ensure that you are on the right and appropriate regimen for your situation, and that you're not causing more harm to your body than good. So, you know, again, I'll reiterate, make sure you have a primary care doctor that you feel comfortable with, that you have good rapport with, and that you feel comfortable asking questions. Come to them with questions. Be honest about your social situation and be honest about your medical history.
Thank you so much for that. I do appreciate you saying that, you know, if you're not comfortable with your physician, fire them, get someone else. That is something that we have stressed in the various workshops that we had, because some people just feel like, oh, you know, I have to stick with this doctor. But if you are uncomfortable, if they are not giving you what you need and deserve, then it is okay to let them go. You need to find someone that you are compatible with, someone who, you know, has that compassion and who's listening to you. So that's super important, because I think that turns some people off too from going back to their doctors, because they don't feel that sense of care, you know. So they're like, ah, you know what, I don't want to deal with them, so I'll just, you know, deal with this on my own. So definitely be an advocate for your health. It's so important, you know. And that's another attachment that I'll send in the follow-up. We have a list that Dr. Christmas created that has, I think it's maybe 20 different key points to use when you are going to your visits, so that you can get the most out of your visits. It's amazing. So I will definitely share that with you all. Yes.
5 of those points were from that list.
Yes, I remember when I saw that. Yeah. I remember. Absolutely. So yes, I appreciate that. Appreciate you including that in your presentation. So yes. So if there are any other questions before we get to our raffle, please feel free to unmute yourselves if there are, or if you want to just, you know, send them in the chat. But again, this has been an amazing workshop. I, you know, look forward to doing this one again, because it's so needed. You know, so often the ER is definitely overutilized. And, you know, we have options. You know, a lot of people don't utilize urgent care, you know, and that's what they're here for. So I do appreciate you all being on board to discuss this. You all did amazing. Appreciate it. So I am going to share my screen so that we can finish this off. Okay. So this is just a list of some urgent cares. I again will include this in our follow-up, just things that, I'm sure you all have seen them in passing and like, oh, okay. But again, this is something that just a few that I picked. It's a lot more, but these are just a few that, I felt the need to share. And the survey, we use these surveys to gauge what you want us to talk about, what you want us to, do as it relates to upcoming discussions and workshops. So please take a moment to fill them out. Let us know what you thought about tonight's workshop as well. So please, when we send that to you, please, fill them out because we do definitely utilize the information that you share with us. So again, we have events coming in 2025 and they will be.
There's a couple questions in the chat about sharing the workshop.
Sharing this workshop?
Yeah, the recording.
Oh,
yeah.
Okay, absolutely. So what will happen is we will post it on our Facebook page, our UChicago Medicine Facebook page, and we also upload it on our YouTube page. So if you don't have Facebook, then you can definitely rewatch it on YouTube. So please, definitely, we love that for you to watch it and also share it. This is valuable information. So please share it out. So we are now going to spin the wheel for our raffle. Wait, let me just go back and make sure. So again, we just want you to follow us on YouTube, Facebook, Instagram. We have our YouTube page. UCM Urban Health Initiative is our, where you can follow us. But, just to find out about upcoming information, health resources, recordings, etc. A wealth of information on there. And then if you want to contact us about any upcoming events, or if you'd like for us to present at something that you may be interested in hosting, please let us know. This information to be shared as well. And again, I just want to thank everyone for your time. We appreciate you being here with us this cold Wednesday evening. So thank you all so much. So Afia, are you here to pull up the wheel? 1 second. There we go. Okay. Afia, these names.
No, this is wrong. Or
Yep, that's wrong.
sorry.
That's okay.
Let me go back to the link you shared.
Okay. Thank you. Let me remove that. So yeah, this is something that we're doing new now for our participants so that we can do it live so that they can just, see it. Was pretty cool to see your name spinning around and hoping that it lands on there.
Does this look better?
It's still a couple of names on there that's not on there. Yeah.
Names on there.
Huh?
Was that somebody else?
Mm-hmm.
Names.
Who's that?
I don't see Loretta on there.
Okay. All right, Miss Loretta. We got you.
I don't know. Do you have I don't know. That's the link I got from the email. I don't know.
Oh, so no, that was from a previous one. So for this workshop, you have to enter the names of the people I'm sorry, I should have cleared those off, but.
Okay. Okay, let me stop sharing.
Okay. So while we wait, let me see if there is anything in addition that may have come up. Oh, okay, that's a question pertaining to this workshop share. But yeah, if there's anything else, chime in now. And I'll just mention that for one of our upcoming workshops that we'll be having next year, normally it's done in January, but it's an in-person winter wellness fitness event. So we pushed it back from January. So this year it'll be in February. And again, you'll get more details forthcoming, but an in-person fitness event in which we will have 3 different fitness demos. We'll have a panel that'll talk about heart health. Lunch, we'll have live raffles, we'll have resource tables. So it's an amazing event. So again, more details are forthcoming. It'll be February the 1st from 10 to 2 in person at the Shine Bright Community Center. So yeah, now we're cooking with grease. All right.
Sorry about that.
No worries. Our winner is Vita. Vita, are you still on the call?
Yes.
Wonderful, wonderful. So you are our winner for this evening. So I
Wow.
will be in contact with you to get your information so that we can send you out your gift card. And we thank you for being here.
Thank you.
Yes. Yes.
And I
Okay.
think there was one question about sharing the urgent care locations again before we finish.
Oh, they wanted to see that list again?
Yes.
Okay, not a problem. And this will be in our in the follow-up email, but I'll share it again right now. Here we go.
The location, February.
I'm sorry?
If you know the address of the event in February.
It's on 85th and Cottage. I don't have the exact location on me right now, but it's the Shine Bright Community Center. Okay. I'm sorry, but yeah, we definitely will have more details forthcoming on that. Okay, so here we go.
Used to be called the Discovery Center.
The Shine Bright Discover Center. Okay, and this is this is the urgent care list. And again, I will share this in the follow-up email that you will be receiving via email. So I will share this out with you all.
14:30.
You got it? All righty. I'm gonna stop the share. All righty. Again, thank you all so much for joining us. We appreciate you all. And thank you, Afia. So the address is 8560 South Cottage Grove. That's for the Shine Bright Community Center for our event that we're hosting on February the 1st. But again, please make sure that you sign up for our newsletter, as well as, you can check out our social media locations. We will definitely be promoting it more on those sites. So again, I'm going to turn it over to the team if they had anything that they wanted to add. If not, we are going to go ahead and wrap this up. But again, I thank everybody for participating, and we look forward to you all joining us for upcoming events. So team, anything?
Nothing for me, just thank you to Aisha and our speakers for your time this evening. It was very informal. Very informational.
Thank you so much. Appreciate you. All right. All right. Thank you all. Everyone, enjoy your evening. Please stay warm, and we look forward to seeing you soon.
Holidays.
Yeah, same to you. Take care. Bye-bye.